There are mainly two ways of treating abdominal aortic aneurysm, and the classical way, okay, is open repair. Okay, open repair. Open repair means we make a big cut in the tummy, and then find the aorta, and then excise the aneurysm, and then put in a tube to replace the aorta, and then suture the tube, the what we call the graft. Okay, suture the graft to the aorta to replace the resected part of the aorta. It's a very effective operation. It can effectively remove the aneurysm, but the problem of this operation is we need to make a big cut in the patient's tummy, and sometimes even though we can do the operation successfully, but the patient may not be able to fit enough to go through this operation. So sometimes some patients who are not that fit may not be able to undergo this operation. That's the problem. So another way of fixing this aneurysm problem disease is we can actually avoid opening up the abdomen, and instead we can go through the artery and the aorta from inside, and to put in a stent graft. We call this endovascular repair. Okay, so what we can do is we can, instead of opening up the abdomen, we just make two small cuts at the groin, and then through the artery at the groin we pass through some instrument through the artery into the aorta, and then at the right position we open up a stent graft. Yeah, I can show you some stent graft. This is the kind of stent graft we use put inside the patient's tummy. Yeah, so it's made of two material, some graft material which are watertight, and some metal which helps to fix the graft inside the aorta. Yeah, so by putting this kind of stent graft inside the aorta, it helps to drain, to guide the blood to go through this stent graft, and then prevents the blood from leaking into the aneurysm. So when the stent graft is at the right position, the aneurysm will then have no blood going into the aneurysm, and the pressure inside the aneurysm will be much smaller. And with time, the aneurysm will get smaller and smaller, and then sometimes it can almost go back to the normal size. So this is by doing this, we can fix the aneurysm, but without opening up the abdomen. So more the advantage of this procedure is more patients can undergo this operation, because we don't need to open up the abdomen, just two small wounds at the groin, so the trauma of treatment will be much smaller, and the patient can also recover much faster than before. The days of staying in the intensive care unit will be much less. Usually sometimes 1 day or 2 days, or even sometimes some patients they get out of the operation room directly to the general ward right away. So it saves some cost as well. Usually what we need to do is we need to put in the stent graft inside the aneurysm, and because at the aorta there are two arteries which supply blood to the kidney. We call that the renal artery. And when we position the stent graft, we have to position the stent graft right below the renal artery. If we position it too high, then it covers the renal artery, and then they will shut off the blood to the kidney. That's not a very good thing. So we have to position the stent graft right below the renal artery to fix the stent graft at that position. And this is a bifurcated graft. By putting this bifurcated graft, we can guide the blood to the two lower limbs. Okay, but sometimes if we don't have much time to do this, what we can do is, for example, when the aneurysm undergone rupture, that means it's bleeding. Sometimes to save time, we can put in what we call a aortounitic stent graft or a tube graft, just one tube. And then by putting in this tube, we can guide the blood to one leg, and then afterward we can construct another graft to drain the blood to the other lower limb. So this is what we call an aortounitic stent graft. So these two stent grafts are the two commonly used stent grafts nowadays.